ERP software for behavioral health. If you are tracking beds on a whiteboard and logging maintenance by text, your operations have already outgrown your tools. Enterprise resource planning built for treatment centers changes all of that. This is Behave Health's ERP layer, the operational backbone built directly into the same platform as your EHR, CRM, and RCM. We will cover property and bed management, human resources, contacts, community organizations, scheduling, tasks, mobile-first design, and HIPAA-compliant file storage. ERP, Enterprise Resource Planning, is the operational layer that covers everything outside the clinical chart. Properties, staff, schedules, tasks, vendors, and documents. The work that keeps your program running, but lives outside the clinical record. Behave Health built ERP directly into its EHR, giving treatment centers a complete operational solution rather than a patchwork of disconnected tools. Designed to fit every scenario, from a single outpatient center to a multi-site inpatient detox. When treatment center operations run on whiteboards and shared drives, the gaps are real. A whiteboard cannot alert admissions the moment a bed opens. A spreadsheet cannot flag an expiring staff credential. Maintenance requests by text get lost. Tasks assigned verbally are never tracked to completion. Patient documents and employee records in email and shared drives create the risks a HIPAA-compliant database is designed to eliminate. Behave Health's ERP includes 6 operational modules, all inside the same platform as your EHR, CRM, and RCM. No separate login, no duplicate data entry, one source of truth. Module 1, Property Management. The bed management system replaces your whiteboard or spreadsheet with a live digital view of every bed across every property. Maintenance requests flow from submission to resolution. House managers submit from mobile. Administrators track costs across every property. Assign house managers to each property to ensure there is always someone on duty. Module 2, Human Resources. Each user is assigned a role that controls exactly what they can see and do within the platform. Every role has its own permissions you can customize. You can even create entirely new roles, manage availability, assign tasks with due dates, and get alerts before staff credentials expire. Module 3, Contacts and Communication Logs. Track every contact your team communicates with, family members, community organizations, and outside providers. Phone calls, emails, and text messages are logged against each contact record, so nothing falls through the cracks. Module 4, Community and Organizations. Add vendors like banks, utilities, and suppliers into the organization directory, so their information is always accessible. Connect patients to the employers, religious organizations, and support groups in their community. Track the providers your patients engage with and assign tasks or log communications against every organization record. Module 5, Scheduling and Attendance. A simple 3-step process. Pick a day and time, connect a location, and link the right staff and patients to each event. Every team member sees the same schedule, in real time, on any device. Module 6, Tasks and Accountability. Assign tasks to staff, patients, and vendor organizations. Monitor completion and hold everyone accountable. Combine tasks with property and vendor management to track maintenance repairs and vendor work orders from open to resolved. Behave Health is fully responsive, desktop, tablet, and phone. Your team can do their work in every environment they operate in. View tasks, check schedules, add patient leads, and process check-ins without being tied to a computer. Add housing notes and incident reports the moment they occur. No backfilling, no misdocumentation. Add drug test results, view properties, and check organization contacts from anywhere, at any time. Store every sensitive document in a secure HIPAA-compliant database, not in email or shared drives. Documents organized by patient, employee, property, and organization. Intake forms, HR records, leases, work orders, and more. Role-based access keeps documents visible only to authorized personnel. Every access is logged for audit purposes, supporting HIPAA-related audits and accreditation reviews. The ERP layer sits inside Behave Health's full platform alongside 3 integrated products. CRM for leads, admissions, and alumni outcomes. EHR for clinical, medical, and housing documentation. RCM for insurance verification, billing, and denial management. All 4 systems in one platform, from first contact through discharge and billing. Stop managing beds on whiteboards and staff accountability by memory. See Behave Health's ERP software for behavioral health in action. Book a 20-minute demo at behavehealth.com.